My name is Dr. Rick Saguil.
And action. Hey, Jay had a... This is Kirk again. And action. Hey everyone, it's Dr. Rick. And Teresa had a question about chronic fatigue. And I just did a tutorial chronic fatigue, but as I watched it, I realized that I started with the top 5, but I didn't finish with the top 5, probably because there's so much crap that occurs with chronic fatigue and fibromyalgia for all that matters. But if this is the first time you're finding me, don't forget to hit the subscribe button down below, the alert button, and if you are in a group that suffers the same, please share this with other folks, because I will tell you, a lot of my colleagues don't... They usually just go straight to antidepressants and say it's in your head, which is terrible. Or people on the street, if anybody uses that term anymore, hey boomer, people on the street will just say, oh yeah, chronic fatigue, yeah, I'm tired too. And it's like they belittle the condition, although there is a so the new diagnosis is systemic exertional intolerance syndrome, or disease. SEEDS. And when it's a disease, that means there's a protocol or an algorithm to come up with the disease. So it is a disease, and we shouldn't belittle it because a lot of people are suffering from it. The thing is, it kind of mimics a lot of other diseases, so you really have to have everything ruled out. Hopefully you have insurance. That's what insurance is for, I guess, catastrophe. But when it's all ruled out, like Teresa going to Mayo, then let's play around, because usually the next treatment, so people get diagnosed and they get everything ruled out, $10,000 workup, and then suddenly the ball is dropped because it's like, what do you do? Oh, let's just go back to a psychiatric medicine, Cymbalta, Lyrica, sometimes gabapentin, trazodone, and that's it. It's like, no, because those medicines, I mean, at the worst case scenario, it's fine to use. But those medicines cause so much. They are for the brain to stop the firing, but you can't just stop the firing of pain, because you'll stop the firing of thinking and wakefulness. So the pain control causes fatigue, and it's the chronic fatigue problem. So I think there's ways to take care of things based on how off balance the society is nowadays. Because I have millennials coming in chronic fatigue. I got some new moms in their 20s. I got some boomers that are coming in. It does not, there is no harbor of safety. Every age group is going to have this. Kind of like fibromyalgia in the 90s and the early millennium. But anyway, yeah, in fact, it mimics it, except for the exact diagnosis, but the treatment, I say, is about the same. I think chronic fatigue is even worse, because the CFS patients, if they push over to too much activity, and whether that's exercise, cleaning house, a lot of travel, or even taking a test, brain power activity, they will be flu-like symptoms for about 3 to 5 days, even to the point of not being able to lift up to eat. They might need help, and they just stay in bed because it's just so terrible. So, my top 5 has a dovetail, so I should call this chronic fatigue syndrome number 2, part 2. My top 5 are this. I always say sleep is number 1. Because if you think about it, there's difficulty with getting to sleep. And the difficulty with getting to sleep results in unrefreshed sleep. When you have unrefreshed sleep, you go on during the day totally tired and off schedule with brain fog. And yet, you can't sleep at night. You might be able to oversleep into the day, but the brain still doesn't get the rest. But sleep is supposed to be sanctuary. Sanctuary is supposed to be time to rebuild. It's supposed to be the time when the brain goes into different stages. It used to be stages of sleep. Now it's different. But it goes into different levels of consciousness. And its deepest level of consciousness, the brain and the white blood cells in the brain actually cut some excessive amounts of dendrites. Those are little nerve tissues that have formed that don't need to be there. There's inflammation that occurs in the brain every day. There's pathways with all the root systems. Think of your lawn or a garden. and you have one root going into another root, going into another root. It's just a whole bunch of roots. Sometimes if you have a weed, it'll go into all other roots and it'll take all the water because it's the biggest and most robust amount of roots. So if you have an idea that is sparked during the day, in addition to learning your algebra or learning a new map coordinate or learning a song, the trauma or the traumatic event, whatever it is, as it gets buried in the different synapses and pathways, it will be the weed that takes over the thinking. And you don't want that. So you want, during good sleep, sanctuary, you want to cut all the crap out. So that inflammation that occurs, if you don't cut it out, guess what it leads to? Alzheimer's disease, Parkinson's disease. So we want to get that off, and the only way to do that is a good night's sleep. And maybe DHA and maybe turmeric, like I mentioned in my other video. So check out the other video. I'll put a link down below. So the first thing I say is utmost importance is, even if there's too much sleep, 16 hours of sleep, and then the chronic fatigue where you just can't get up in the daytime and the unrefreshed sleep, I would still say try to push the sleep cycle as best as possible. That means not only taking an herb, and I think I put it down here just as a spoiler, but I think medical cannabis works. But if you're not into medical cannabis, which I think it's a shame, but there's also ashwagandha, 5-HTP, magnesium, valerian, or prescription medicines like Ambien, Trazodone. So those medicines and herbs do work. But the thing is, if you try to reset your sleep cycle, it should be sleep-wake cycle, but then you don't specifically take a hard line, this is when I kind of get to sleep, tidy up, turn down the lights, cool down the room, get comfy, brush my teeth, rinse my nose. And if you don't have a hard line set for this is when I wake up, I try as best as possible. I roll out of bed and roll onto the floor and sit up, do my breath exercises, and try not to take a nap from that point on until nighttime when I reset my sleep. And then you have your meals throughout the day. It has to be hardline. And there's a way to reset and reprogram what you do at night so that the brain initiates and gets used to. Even lavender, I used to do that all the time. Lavender smell, cool temperature in the room, comfy pillow, brush teeth. I like the change in temperature, going from a hot shower to a cold room. And I think the change in temperature initiates a trigger for the brain to say hibernation time. So it just initiates a trigger. And then in the daytime, initiate a trigger, open the blinds, get more active, have more protein, get pissed off if you have to, go outside if you have to, even if you're dead tired, go outside, get stimulated. So that would be the daytime. And then do your hallmark meals during the day, if you can tolerate meals, even if they're tiny bits, it's just a taste of something that gets the gastric acids flowing, and that'll be telling the stomach and the eyes, this is my new schedule. Versus just taking a herb or a supplement or a pill and a medicine and just not having any routine scheduling. You have to have a ritual, and it has to be topped off with the herb or medicine. So that's important. And so that's the first, and that's the most important, that's the easiest. I can't help but say, but I still think the use of the plant, medical cannabis, can be so useful no matter what age. Although in the state of Illinois, you're not supposed to use it if you're less than 18 years of age, but people use CBD all the time for seizures in other states. That's probably a different topic, but I have had a video on sleep. So that's number one. Number two is going to be push crash. No matter how fatigued you are, no matter how stiff your muscles are from poor sleep the night before and no energy, this is an energy issue. And so check out the video from before. I think you have to push a little bit. The problem is, as I mentioned before, most people are walking on a fine edge as far as pushing a little bit of activity, and then suffering 3 to 5 days of flu-like symptoms, being stuck in bed, and terrible life. Versus pushing and then building muscle, and then getting stronger the next day. Then pushing again, building muscle, getting stronger the next day, pushing again. You can see where I'm going, but the problem is it's a fine line, and most of my patients don't know how hard to push. Because the first time you push, if you crash afterward, you're not gonna like it. But just understand, even my fibromyalgia patients, if you push, just test it out a little. Test the water a little bit. Push a little bit. Keep it at 5 minutes. 5-minute walk with a little bit of weight. Now, you saw, if you didn't see my gallons of water, yeah, this is my gallon. This is my 3 gallons or 2.5 gallons of water. So when my son steals my weights in the office, I have to rely on stuff in the room, and I think the water's good resistance. Anyway, carrying something like that'll challenge you for 5 minutes, and then if that's all you do, you're not going to get a huge pump, but you just introduce activity. If you just introduce activity, muscle will say, what the heck is that? But then the positive occurs. Insulin goes down. Sugar, if there's carbohydrate gets put into the blood, into the cell without insulin being around. You might stimulate a healthier gut timing. So I think it's positive, but you have to be careful. Once you get used to how long it takes, how long you can tolerate it, the effects of what you're doing, and then when your muscles will be ready to trial again or test the waters again, you can take a journal. If you're not good at all that stuff, hire a coach. That's what we're for. So I'm going to be a life coach. Isela had a question about, I guess not too many people know, but I'm just getting kind of burned out with this whole situation. So I'm thinking about other things to do. And one of them is being a life coach. I mean, obviously I'm going to be more than a personal trainer because my knowledge base, I'm going to be the best damn life coach in Chicago. So you just watch my mark, because I'm going to start putting it down now. However, I think that you can get a life coach to keep eyes on you, do the journaling for you. That's what we're for. I'll be taking my test one of these days. I haven't decided when, but I'm back. So this is what I'm studying for, NASM. And it's pretty good. I think the theories of what the young people study, and there's a couple old people that I saw in testing, or at least in testing center online. The theories are good. I think that it'll complement my knowledge base, and then I can get into the gym. And by the way, if you haven't heard, I am running a Ignite Your Life Part 2 at Endorphin Effect. That's the driveway across from my office, right behind the Walgreens. We're going to be taking a lucky group of up to 40 to 50 people from 12 noon to about 1 or 1:30, and just showing you what I do. My 15 minutes of hell, you don't have to do it like that. And but I think still giving you some ideas, some nuggets of information that you might be able to test drive later. You can test drive it for the 45 minutes that we're going to be doing physical activity. You're doing 15 minutes, 5-minute transition break, 15 minutes, another 5 minutes, 15 minutes, and then the final talk and Q&A. So I'll put a link down below. Sign up if you're interested, send somebody else the link, and we'll all learn together. But, and if you haven't seen Jacob Teitelbaum's book, pretty good book, easy read. I haven't marked this up. This is one of my first books that I read when I had fibromyalgia. And I now, if you go to my office, I mark everything up. I put stickies everywhere. In fact, I have more stickies and markups than books and paper. So next, so push crash, if you can afford the copay, get a physical therapist. If you can't afford a good life coach, you can't find one, physical therapy. Some of them are pretty good. Lori over at Streamwood Park District, who works for Advocate, is fantastic. So just props up to Lori. The third bullet point is mood. This is a tough sell because nobody likes to divulge their stuff to other people, but it's so cathartic to just have a conversation. It's not like you just sit on a couch and you just start crying. The therapist, the psychologist, mine is Dr. Nicole Parmalee. I'll put a link down below for the video I had. In fact, I shot the video thinking that I'm just going to show my patients what a session would be like. And then we started to talk about Q&A, and I'm like, wow, those are good questions. I had to reflect, and Dr. Nicole pointed out a couple things in my language, and I had to turn off, I couldn't film that part, or I didn't want to show it. It's more private, and fantastic. So I have follow-up visits scheduled. So my therapist, my psychologist that I would send patients to is now my psychologist, because I think it's very important. I thought I was pretty in tune with mindfulness practice and self-reflection, sanctuary, but she showed me a lot. Again, the value of a coach. So I think that the mood has a direct correlation with brain tissue and the function of the brain. And that brings me to, not only does the brain need rest, going back to number one, but the mood needs to be, you have to be living in the now. You have to be mindful for the current time, because it's too common to be dwelling on the failures of the past and then be ruminating about that. It's also very common to be anxious about something that hasn't happened yet. And if you're always talking or living in the past and the future, there's no way you can live in the now. Mindfulness practice usually can be done if you can't afford anybody, you can't find anybody, you live in the boondocks. That's beautiful, because the boondocks are a way to get mindfulness practice. Japanese forest bathing. I've got a lot of videos where I'm hiking and I'm holding and talking, because I got to kill two birds with one stone. So mood has to be answered and appreciated, developed. Same thing with the brain. So I'm going to kind of squeeze two in one, as being number 3. The mood should be worked on twice a day, every day, mindfulness practice. But the brain does need fuel. If you give yourself bad fuel, you will give yourself bad mood. So food and mood go together. Please try to move away from processed food as best as possible. You might have to learn to cook on your own, or you might have to refrain from all the processed stuff and getting something else that's freshly cooked, perhaps. There's a lot of places that do prepare freshly cooked stuff, or they send it to you. I know it's money, but you're going to invest in something new versus investing in a copay, prescription, procedures, and hospitalization. So one way or another, you're gonna have to invest, and I would rather invest in food. If you get food, not only will it help the mood, it'll also help the muscle. It'll also help the muscle, part 2, or number 2. So I put on my previous video a shortcut to possibly considering ketosis or a ketogenic diet. It does work. And you don't need to have, if you're insulin resistant and a little bit heavy or a little bit diabetic, sometimes trying to work with your carbohydrates as a fuel source might not be that easy. So the other way around it is just give your body a taste of a different fuel, which is fat, heavy fats, or I should say healthy fats, in the form of a ketogenic diet. You might have to have a coach talk to you about or design something for you as far as how to do that. I did it on my own. It was a little tough as a vegetarian or vegan. I'd be new enough. The majority of my meal would be like omega-3, olive oil. And it just it didn't work for me. Plus my IBS flared up. So Deepa, who owns DuPage Dietitians in Lisle, is excellent. You don't have to be vegan, but she will help manifest and design something for you. Maritza Moreno, one of the coaches at my first Ignite Your Life conference, also in Elgin, near me, is excellent as well. And she runs a factory of exercise. So I'll see if I can put both links down below to these two folks, great healers. But if you need a coach to design, cool. If you have to go to the hospital because that's the only thing you can afford, I'm not sure. We do have good registered dietitians, but they might not agree with what I say. It's better. It's easier to have a coach than do it on your own. So, 4th would be gut health, and because the hypothalamus is off, that's the fuse that's blown, and the pituitary is listening to the hypothalamus, and the pituitary is off because the hypothalamus is off. That means your thyroid, the adrenal glands, and your gonads will not be in sync. So not only that, but if the hypothalamus is off, and you'll have all the symptoms of those 3 organs not working, but if the hypothalamus is off, you'll probably have a lot of gut problems. Leaky gut will always be a challenge. The microbiota that are in the gut will probably be off because you're not sleeping well. Different bacteria come out at night and repair, different bacteria come out during the day and repair. And if your sleep and wake cycle is screwed up, those bacteria don't know what to do. So the nighttime guys will probably destroy the daytime guys, and daytime guys might screw up the nighttime repair. So it's nice to get the gut into good health, and that would be with decreasing exposure to crap. So I just don't like, meat eaters, I just don't like dairy. I can make an argument for raw dairy that comes from a grass-fed only farm, but it's just so hard to find that, and you have to worry about botulinum, Clostridium. So I would say it's easier just to avoid dairy. There is certain things in meats that you have to be careful about, especially depending on how the animal was raised. Cattle, the industry is tough. And yes, there are some issues with plants, but I think for the most part, if you read, I don't have the book here, Plant Paradox, and I mentioned it in the last video, I think it'll give you a good guide as far as things to avoid, things to accept. But if you whittle it down to just the essentials as far as fuel, then and you build up the gut. Again, the gut would get help if it's timed right. If it knows when it's time to eat, then it'll only secrete digestive enzymes at that time. If it doesn't know when to eat and you're trying to retrain it, then taking digestive enzymes before your meals would help if the pancreas isn't working right. You take the digestive enzyme, you take your meal, and it's got to be very narrowed with no crap, limited processed food, no alcohol, no coffee, no dairy, and a couple other things that are irritating. Then you might be able to digest properly. You might lose weight. Some of you that might be okay. Some of you might not be good. But if you just train the gut, maybe take that Saccharomyces I was talking about for a short amount of time as a substitute for your usual probiotic, and get the basics to eat, also have prebiotic in your basic foods, you might be able to get good gut health. I have a video where I talk about marshmallow root, marshmallow root, slippery elm, and DGL. That all work as slippery things to coat the stomach, the small intestine, and the colon. I think those things are good. So if you establish regimented pace as far as when you expose yourself to eat, that means having a window of when you eat only and not eating or drinking outside that window. I think you'll train the gut, you'll train the brain with the sleep cycle, and you'll have a faster turnaround time. If you fall off the wagon, that's okay, but once you get back on these bullet points. That's about it. And then looking for other diseases as far as the gut is concerned. And mood is very important for gut, because this mood issue, if it's off, can offset the gut too. How many times have you been anxious and you had to go poop? Well, maybe not you guys, but me. I don't like eating going on a plane because I hate going to the bathroom in the plane. Anyway, and then finally, utilize what's available to you. I put CBD, THC, and LDN, and I should have put down acupuncture too, because I think it's a necessary therapy to pull everything together as far as healing. So these are, this is over the counter. CBD and THC are over the counter, but in the state of Illinois, you have to have a medical cannabis card. LDN, or low-dose naltrexone, is a prescription, but it's only made by a compounding pharmacy. And we got a couple of different compounding pharmacies around here. My favorite used to be Wholesome Health Pharmacy, but Matt changed his life too. And I think that Mark Drugs is common, Martin Avenue Pharmacy in Naperville, and then Wakanda Pharmacy are all great pharmacies. But they can make low-dose naltrexone. And low-dose naltrexone, I can't talk about it right now, it's too lengthy, but I'll put a video on the LDN. Check out how to use LDN for cancer. Not that you guys have cancer, but it'll be the same reason that we use it, to reset that circadian rhythm and start to get those endorphins, those receptors going in the body. So CBD, check out my videos on CBD and THC for sleep, CBD and THC or the endocannabinoid system to reset everything, to become the hypothalamus, or at least get the rhythm of this hypothalamus. It's kind of like push starting an old-fashioned car. Everybody gets to push start the car, and then the guy that's in the driver's seat pops it in gear, and then the engine goes. That's the old-fashioned way. I don't know if anybody does that anymore, but it would always work, especially when somebody had a bad starter. So that's how you can use CBD, THC, and LDN. As far as acupuncture, if you're chronically fatigued, check out my video on acupuncture, because when I saw Dr. Mabel Angel, I tell you, I wasn't expecting it, but after I was done the acupuncture session, it's like my heart was racing, and that wasn't from just meeting her. The heart was racing, my energy was abounding, you can see in my voice. I think acupuncture is great. It's not covered by insurance, but Mabel Angel, Dr. Mabel Angel, does take insurance, so you might want to check her out. So I think I put doc here because I meant drug of choice. Not that these are really drugs, but I think that in addition to maybe a couple of supplements, but you can't do the supplements until the gut's healed up, because that might just upset everything. So these are the basic essentials. Low-dose naltrexone, it is a pill, but such an innocuous pill. THC and CBD can be taken inhalation form, tinctures, you don't even have to bother the gut. So these are my top 5. And if I was to try to target somebody, and everybody presents with chronic fatigue differently, I would work with designing template around these top 5. At least, and everybody might have a different priority. Some might be shoveled around, but if you get this under control, even if you don't get the chronic fatigue completely resolved, you at least compress the events. And if you compress the events, you'll feel much better. Instead of 5 days, you make it a day and a half. That's pretty good. That's almost like a regular workout. How many of you work out and like, oh, for a day you can't walk, you look like John Wayne, or if you know John Wayne, Frankenstein. But then you know that something good is coming because the muscle will repair itself. Well, if we can have a chronic fatigue patient compress the flare-up or the crash part to a day and a half, that'd be awesome. And then during the time of recovery, if we really expand the recovery, this would be a better world. We'd have less chronic fatigue, we'd have less fibromyalgia, everybody'd be happy. And less coronavirus. Now, who knows? So hopefully this gives you a little bit of an idea about Teresa. I appreciate you going to the Mayo, but if you take the course again at the Mayo, cool. I think you'll learn a lot. I can certainly get all that stuff here. My old patient Mark went through all that, and they did pretty good. They taught him a lot of stuff. We can teach that here, but hopefully we can push past this. And I think the most important thing with conquering a disease is the knowledge base about the disease. So learn a little bit more. There's a couple of good videos. Check out Dr. Jacob Teitelbaum and his videos. Otherwise, if you have comments about how you conquered this thing, please put them down below. Maybe give me your top 5, and I'll see you at the next Minute Clinic.